So the donut or the periareolar mastopexy is very good for someone who doesn't need a large lift, but really just needs more tightening or repositioning. The word mastopexy actually means breast tightening, not lift. So in someone whose breasts are very low, you really need a significant lift. This is not a good procedure to use. It's not going to work. It's going to cause significant widening of the areola, widening of the scar. This is a very good procedure for someone who's smaller, needs a smaller lift, and in her case, needs the areolas repositioned and centralized.
When would you use a lollipop incision over an anchor incision?
Depends upon how wide the breasts are. I only use the lollipop in very specific circumstances because I think the anchor with the scars along the bottom is pretty well hidden anyway, and I think the shape ends up being nicer. Or patients who say they don't want a scar that runs down the center of their breast and they only want the periareolar. The problem is if they need an anchor scar or a lollipop and you don't do it, if you try and do a periareolar, the scars end up being wider. The anchor or the lollipop scars tend to heal with finer scars for patients who really need it. But we're going to put a permanent suture in here called Gore-Tex, which tries to prevent the widening of the scars. In her case, she shouldn't have an issue because it's not that large and we're not doing that much of a lift, so she's an ideal candidate for the donut or the periareolar mastopexy.